Hello everyone, I am Sammani Herath and today I will be presenting a clinical case titled Postpartum Metritis and Exotoxemia in a Nigerian dwarf dog. About case history, this case involves a 4-year-old intact Nigerian dwarf dog that had kidded just 2 days earlier and then she delivered 4 kids. 3 were healthy but 1 was stillborn. Soon after parturition, the owner noticed lethargy, anorexia, reduced milk production, and rapid progression to recumbency. A private practitioner initially treated her for suspected metritis, but due to weakness, she was referred to the LCU clinic. I am going to explain clinical examination and findings. On arrival, the dog was recumbent, dull and severely hypothermic at 35 Celsius. Her mucous membrane were congested, which indicated systemic shock. Respiratory examination revealed tachypnea with crackles and wheezes, suggesting pulmonary involvement. The rumen showed complete atony. An ultrasound further revealed intrauterine fetal remnants confirming severe uterine pathology. Significant in blood work. Blood work showed a severe inflammatory leukogram consistent with septic shock. These findings supported the clinical suspicion that the infection had progressed systemically, contributing to her weakness condition. Gross pathology. On necroscopy, the uterus was markedly distended and filled with a malodorous viscous exudate, and the serosal surface showed sharply demarcated purple necrotic areas indicating gangrenous metritis. The lungs were heavy, wet and mottled, typical of acute pulmonary edema. Additionally, marked subcutaneous edema was present in the neck and thorax, consist with exotoxemia. Histopathology and etiology. Histopathology showed transmural coagulative necrosis of the uterus along with degenerate leukocytes and fibrin thrombi. Gram staining revealed large gram-positive bacilli. Immunohistochemistry confirmed that the presence of Clostridium sodeli, a highly fatal clostridial pathogen. So, the final diagnosis was acute clostridial metritis with terminal exotoxemia. Pathophysiology of Clostridium sodeli. The infection typically begins when bacteria from the environment or feces enter the uterus, especially after dystocia or retained fetal membranes. The postpartum uterus provides an ideal anaerobic environment for Clostridial spore germination. As the bacteria proliferate, they release lethal toxins, mainly TCSL and TCSH, which cause vascular leakage, tissue necrosis, and rapid onset shock. So, this explains the extremely fast clinical weakness in this case. Treatment and prevention. Once systemic toxemia develops, the prognosis becomes poor to grave. Aggressive treatment may include high-dose IV penicillin, tetracyclines or clindamycin, along with IV fluids and anti-inflammatories like flunixin. Uterine ecbolics such as oxytocin or prostaglandins may help expel retained membranes. Preventive strategies include proper prepartum management and selenium supplementation to reduce the risk of retained placenta. Conclusion. In summary, postpartum metritis caused by Clostridium sodeli is a rapidly fatal condition. So, early detection of retained fetal membranes and immediate antibiotic therapy are essential for survival. So, this case highlights the importance of prompt postpartum monitoring in small ruminants. Thank you.